Kathy Blake, and value-based care and vulnerable populations have been the primary focus of my work for almost the last 12 years here at Summa Health. I am a registered nurse with 36 years of clinical and administrative leadership experience, and today I serve as the Senior VP for Post-Acute Division here at Summa. And what falls underneath that is our partnerships with our JVs for home care and hospice, inpatient rehab facilities, long-term acute care hospitals, our home infusion program, and our SNF collaborative. I also have oversight for our integrated care management team, which encompasses hospital acute care management, which are RNs and social workers and folks, our ambulatory ACO care management team, and our enhanced care management programs. And lastly, I have oversight for our Complex Care Institute, which is geriatrics, palliative, and complex care clinical programming, our fellowships, and our research programs. In addition, I served as the president of the ACO, which is known as New Health Collaborative, for 2 years. So today we're going to talk a little bit about what is value-based care. So value-based care and fee-for-service are two different models of healthcare reimbursement. In fee-for-service, providers are paid based on the number and the type of services they provide, regardless of patient outcomes. And in value-based care, providers are paid based on the quality of the care they provide, measured by patient health outcomes. So value-based care aims to reward providers for efficiently managing the health of individuals and of the populations. Value-based care ties to the amount of healthcare providers earn for their services to the results they deliver for their patients, such as quality, equity, and cost of care. And through financial incentives and other methods, value-based care programs look to hold providers more accountable for improving patient outcomes while also giving them greater flexibility to deliver the right care at the right time. So value-based care is a healthcare delivery model under which providers, so that's hospitals, labs, doctors, nurses, are paid based on the health outcomes of their patients and the quality of services rendered. So under some value-based contracts, providers share in financial risk with health insurance companies. And in addition to negotiated payments, they can earn incentives for providing high quality, efficient care. So value-based care differs from the traditional fee-for-service model where providers are paid separately for each medical service. And while quality care can be provided under both models, it's the difference in how providers are paid, paired with the way patients are managed, that provides the opportunity for health improvement and savings in that value-based care environment. So what is the potential benefits of value-based care? So in value-based arrangements, healthcare organizations are incentivized or they're rewarded for meeting those various interrelated goals that I mentioned earlier. The goals typically aim to improve measures around quality, cost, and equity. If they're not met, organizations may forfeit bonuses or lose a portion of their payment from payers like Medicare or Medicaid, or even commercial health insurers. So there are different alternative payment models for different areas of healthcare. So there's the total cost of care model, which is a Medicare shared savings program, and the ACO model. There's the episode-based payments, which some of you may have heard of. There's bundled payments for care improvement. There's an oncology care model. It's now called the enhanced oncology care model. And then, of course, there's primary care transformation activities that changes how care is delivered within a primary care practice. So those are all types of alternative payment models. At Summa, we have an accountable care organization known as New Health Collaborative. And we do have a Medicare shared savings program, which is traditional Medicare patients. We also have value-based care agreements with commercial payers. So we have a couple of those. I think we have 6 or 7 of those. So we take data from those payers and we take data from our electronic health record, and we can look at how well we're doing, how well we're meeting some of the goals and objectives around those value-based care contracts. And recently we were looking at diabetes and how well we are managing the population with A1C control. And we found that we had definitely had some opportunities. So as an ACO, we had to take a step back and think about how could we manage the care of the diabetes population differently that would provide better outcomes for patients and achieve the metrics that we were looking to achieve as we participate in these value-based care programs. So how we managed that here within our ACO is we did what we call a year of diabetes. So we spent an entire year, and it actually rolled into the next year, where we were highly focused with our care management teams and our transformation teams that worked within our provider groups, focused on a couple of things related to diabetes care. So we were focused on ensuring that patients were taking their medications and that they had A1C metrics drawn timely, so that we could see if they were falling within a tightly controlled range. We also focused on diabetic foot exams, diabetic eye exams, to ensure that we were meeting all of the quality metrics within those value-based programs. So that meant the engagement of our transformation team, the engagement of our care managers, and the engagement of our pharmacists, because one of the other components we looked at was the use of statins. So that focused work, education at the practice level, engagement with patients around their diabetes care allowed us to significantly move the needle on where we were at in terms of outcomes. And we began to meet those metrics and those measures, and patients had better outcomes. So how does this all add up to improved outcomes when we're looking at value-based care? Things that can happen when healthcare is coordinated and efficient, its data and technology are utilized effectively, and patients are engaged in the care. So individuals have a better experience navigating the health system. More people get preventative services like colonoscopies and mammograms and flu vaccines. Risk factors and early disease are more rapidly detected and addressed. Chronic diseases like high blood pressure and diabetes and kidney disease are more likely to be under control, and there are fewer emergency visits, hospitalizations, and readmissions. Thank you.